Hi, it's Dominic from the MSguide.com. I'm an MS patient of 28 years. Touch Independent Medical Education has asked me to give them a patient's view of the highlights of ECTRIMS this year. ECTRIMS being this really massive medical conference that happened in Amsterdam a few weeks ago, and it's easily the biggest MS conference in the world. I was there, and I'm going to try and use what I learned to share what I think is important for patients. I was at ECTRIMS 2 weeks ago, and I was trying to take out of ECTRIMS the patient stuff, because it's really academic and it's a ton of doctors and scientists, and that's a really good thing. But sometimes I feel that us, the patients, don't always make it into the conversation. And half of me gets it because it's about the science, but the other half is it's about us. It's about the outcomes for us. It's about slowing, preventing disease, making having MS as small a thing in our lives as possible. So with that in mind, my 3 highlights from ECTRIMS are the following. Number 1, there is increasing evidence. I would say as a patient and with a science background, it's becoming overwhelming. The sooner that MS is treated with a high efficacy medication, and by high efficacy, I mean things like the mAbs. So in no order of favoritism, you've got alemtuzumab, ocrelizumab, ofatumumab, all these kind of drugs. There's also Tysabri, which is natalizumab. You'll notice something in common. They're all mAbs, which is monoclonal antibodies, like many of the most effective drugs these days. But the point is, when a doctor intervenes, no matter how bad or good my MS may appear when I present, it may appear to be a very, I hate the term, benign, but nonetheless, whether it's highly aggressive or not very exciting looking on MRI, it is better for the patient, regardless, to start them on the highest efficacy therapy the soonest. And within the patient community, I got to say, there's complete bafflement sometimes at why doctors would sort of take a step back and go, well, let's just start you on something mild. And so I don't understand personally why doctors don't treat everybody like that as soon as possible. It's about risk with DMTs for patients. And I do scratch my head sometimes, because not all doctors, when they diagnose a patient, sit them down and say, we are looking at you for 30 years' time. That's how I, the doctor, am trying to medicate you, the patient, is to minimize your disability, which is pretty much guaranteed in MS. I've got some too. It's really about explaining that a highly effective DMT will increase the time between relapses, hopefully, and decrease the severity of the relapses, hopefully. So that's the whole aim of treatment, because I need to live a life. You need to live a life as a patient, or a patient needs to live a life as hopefully as disease-free as possible. And only by medicating effectively is that going to happen. Everything else from ECTRIMS, it was incredibly cool science, and it was really just invigorating to see how much work is being done and all the incredibly clever people who are turning their minds to making ultimately the lives of patients like me and other people better. So thank you very much.